For those who don't know me, my name is Rosemary Becchi, and I'm running for Congress in the 11th District. And we've been doing, over the course of the last 3 weeks or so, a series of virtual roundtables. And this is our 5th one, and frankly, to me, this is probably the most important virtual roundtable we've done. Today, we're going to really talk about how to help our families and our kids get through these unprecedented times. But before I get started, just a little bit about the technology for all of you to know. You can ask questions by typing in your questions into the chat area, or you can raise your hand and push the button and use that function if you'd like to raise your hand and ask the question directly, and we'll call on you, and we'll try to answer questions as we go along. As I said at the outset, this is a pretty important topic. All of our families are struggling through this time. I will tell you and share with you, I have 3 daughters, for those of you who don't know me, and my oldest daughter is a senior in high school. So she's missing all the great opportunities and things that go along with being a senior in high school right now. And then my middle daughter was away at a ballet school this year, a phenomenal opportunity for her. And now she's home. She came home for spring break and hasn't gone back and probably won't. So, it's really hard for her. And then my youngest daughter was supposed to have some surgery done. She has scoliosis, and they canceled the surgery. And so all the anxiety about waiting for surgery, have to be delayed, and she has to continue to think about all that. So, that's just a little bit about what my family is going through. And on top of all that, we've got myself and my husband working at home, which can really, just add to all the stress. But I invited today a very good friend, Carol Barabander, to join us. Carol is a board-certified clinical social worker, and, she just has some incredible tips and things for us to think about as we kind of navigate this. And so, Carol, thank you for joining us.
Thank you.
And I'll turn it over to you to kind of lead us through the discussion.
Okay, thank you, Rosemary. The coronavirus or COVID-19 pandemic has created uncertainty and vast open-endedness. The invisible danger lies outside, in and about our everyday lives. The world has changed as we know it. It is temporary, but it doesn't feel that way. But the world will be different. Normal life has ceased for all of us. We are working from home, can't travel. Entire industries are shut down. We have added now daytime responsibilities working from home, like checking in on the children to make sure they're okay and doing their homework. Needless to say, the outbreak is stressful for many people, causing fear, anxiety, and sadness, with sadness often called the blues. These are normal feelings. However, pay attention to those feelings, as the virus is causing some strong emotional reactions in adults and children. We need to take care of ourselves and our loved ones now and help them cope with the stress of COVID-19. So what are some of the common reactions to COVID-19? The first one is concern about protecting ourselves from the virus. Okay, so what are we doing? We're doing what the CDC says. We're using masks, gloves. We're washing our hands constantly. We're using hand sanitizer. We're doing all of these things to protect ourselves from that virus. Concern about medical care may be disrupted or inadequate. I have my clients, I have older people that I see in my therapy practice that are very concerned about the medical care. and they're saying, am I going to get the doctor? Will I be able to reach the doctor? What about this telemedicine? I don't understand it. Will it be adequate? Is it going to be the same? So those people have a lot of concerns about medical care. And then there's feelings of isolation with this. We're home. We're stuck at home, and we're some of us are alone. I have friends that are alone by themselves, and so they really feel the social isolation. However, in families, you can also feel isolated. It's very interesting. You can be around a crowd of people and still feel isolated. Increased levels of distress in people with existing mental health conditions. This is very important. So if you know someone, you know someone that had some depression or anxiety before entering this COVID time, that might increase. Those conditions might get worse. So just pay attention to that. And fearing survival in people from low-income households and poverty households. This is very important. They're not worrying about some of the things we're worrying about today. They're worrying about survival. So they're at a difficult spot. Now, Dr. David Kessler and Dr. Elizabeth Kubler-Ross wrote the famous book on grief and grieving and the loss and the stages of loss. And I looked at them, denial, bargaining, anger, sadness, and acceptance, and I said, let me put in what it might look like in the COVID time. So with denial, the virus won't affect me. And I actually still see people out there without masks and gloves. And they're thinking, this isn't a big deal. I won't get it. Groups are meeting, even though told not to by the government. Don't meet in groups. People are still doing that. And those are the people that are in denial, saying nothing's going to affect me. This is not going to affect me. Then bargaining is like a bargaining thing. If I do this, you do this. So if I social distance, everything will be fine. And we know that's not necessarily true, right? But that's the bargaining thing that people do in loss related to COVID-19. Anger, you're making me stay at home and taking away my activities. People are angry about this. And this is in the grief process. Sadness, I don't know when this will end. When is this going to stop? When will we be able to get back to our lives? And then ultimately, we want to come to acceptance, which is, this is my and our reality now, and how do we proceed? And with the stages of grief, they're not linear. So it's not like you have to go from denial, bargaining, anger, sadness, acceptance. They go back and forth, but ultimately you want to get to the level of acceptance. Now, what are some emotional strategies to deal with stress and the blues? First of all, take heart that we're all in this together. Everybody is in this. Government workers, celebrities, football players, baseball players, everybody is staying put. So we're all in this together, and it kind of makes you feel a little bit better. Accept your feelings as they are real. Now, I am a cognitive behavioral therapist, and I utilize an orientation called acceptance commitment therapy. That tenets of that say, accept your feelings as they are real. Accept them. Feel them. Don't fight the feelings. Feel your feelings, and they will move on. Okay, so you have to really practice that. If you're not used to dealing with your feelings, accept them, and you have more time now to reflect. So you might want to try to do that. Accept them as they are. Have gratitude. Gratitude is one of the most important things we can do, is to have gratitude for the things we have. There was a study done years ago, and in this study they had two groups, both depressed, tested with the Beck Depression Scale. They divided them up into a control group and a treatment group. And the treatment group was asked to write in their gratitude journal for 3 months, every day for 3 months. And the control group was told to not do anything. At the end, they tested with the Beck Depression Scale and found that the treatment group, the depressed people who wrote in their journal, fared much better and had lower levels of depression than in the treatment group. So have gratitude for what you have. Always maintain a sense of humor. I don't know if some of you, I've gotten some of these little texted or emailed, these little clips of things making fun of coronavirus, making fun of what we have to do and things like that. And they do make you laugh. I mean, they are funny. And so try to maintain that sense of humor. That's always helpful. We can't just lose that. And then there's self-reflection, something that I really believe that during this time we need to do. What have you learned about yourself during this crisis? What have you learned about yourself? What have you learned about your resilience, your stamina, your stick-to-itiveness? What have you learned about you?
Hey, Carol. So I've
Yes.
gotten a question that came in related to just what you talked about. So I thought I'd throw it out there for you. It says, do you have any tips for turning around someone who is pretty negative right now? My husband is negative about the economy, about the kids, about everything. I know he is stressed, but it just doesn't seem good for the family dynamic. Yes,
well, the negative thinking is really very, it's not helpful at all. I'm going to talk to you a little bit about the negative thinking and how bad it is. And can you talk to him? Can you explain that he has to be more positive, that you may learn something from today that you can pass on to him? It's affecting everybody in the household. Does he realize that? Have you talked to him and told him this is affecting everybody? You have to work on your attitude. And the reframing of the negative into the positive is something that I definitely believe in, and he has to do some of that. Now, if he can't, that's going to really create a problem for all of you.
Okay, thank you.
Now, what about active strategies to deal with stress and the blues? Well, research and learning about COVID, the facts about COVID, and this is very hard now to get the facts. But we need to ferret through examine all of the facts that what are called facts, and come up with something that's real. The scientists, the CDC, what they're saying, what the government is saying, try to come up with some facts about what this really is about. All right? Create your new routine. Now, routine is very important, and I'm going to talk about it a little later as it relates to kids. But studies have shown that if you stick to routine, your stress level is highly reduced. So you need to stick to a routine. And now you have a new one. Now, what might that look like? Well, that might look like you're contacting a family member every morning. You never did that before. Maybe you're walking every day. You never did that before. Maybe you're talking to your kids more and having more family discussions. Maybe you didn't do that before. So routine is critical to reducing stress. How about getting proper sleep? Now, I do a lot of work with sleep disorders in my practice, and 7 to 9 hours is normal for adults. Children and teens should have more sleep. But if you get 7, 7.5, that's okay. That's adequate. And the children sleep a little longer, and the teens tend to need it, but they go to bed late and they wake up late, and they're sometimes sleeping too much into 2 o'clock in the afternoon and things like that. But get proper sleep. Now, eating well. A study has shown that eating well decreases levels of depression and anxiety. This is an actual study. And so we need to eat well. I don't know if you have a pet in your home or don't, but if you do have a pet, be attentive to the animal. Hug and kiss and play and be connected to your pet. Pets lower blood pressure. Dogs have been shown to lower blood pressure. And interestingly, I was reading an article about this where one woman said she's with a adoption center for animals, and she said that a lot of people in New Yorkers are actually adopting bunnies. There's a real run on bunny adoptions in New York City, which I found very interesting.
Hey, Carol.
Yeah.
So we adopted a dog. We had been talking about it for a really long time, and kind of this got going probably about 3 weeks ago. We adopted a dog. Is this a good time to be doing that? The dog, I know people are doing bunnies, but a dog's a lot more responsibility for kids.
Yeah, no, I think, well, the bunnies, I think, was because New York City, the apartments are small, but the bunny, which I thought was interesting. But the dog, I think it is a good time to have an animal, to pay attention to the animal. The kids have to have responsibility. It's something very good for the soul of everyone. You feel like you're taking care of something, and I think it is, Rosemary, good that you got the dog right now. And if you have a therapist, please check in with the therapist. Now, some people are saying, well, I can't reach the therapist, or I can't go in, so I'm not going to connect with the therapist. But make a phone call, and I'll talk later about the virtual therapy appointments. So connect with your therapist. Don't just drop out of the whole thing things you were working on. Now, how about working from home and some of the issues? Well, first of all, there is isolation and loneliness. Now, again, if you're in a family, you face other frustrations. But let's say you work and you live alone. The isolation and loneliness is intense because a lot of people who live alone or don't have families necessarily get all their social contacts from coworkers, from work. And so they're missing, that's a big loss for them. So, you have to, and you can be lonely in a family too. I know it sounds strange because how could that possibly be? But emotionally lonely, you can feel, even in a crowd of 50 people, you can feel lonely. Now, the lack of personal space. Okay, remember you have a lot of people in that house sometimes. You might have, and I'm talking about the traditional family now, though there are other families. Husband, wife, the children. You might have another relative. You might have adult children. Right now is varying considerably in terms of who's in that house. But how do you break it up? How do you break up the space so that everybody has some personal space? Very difficult. Even in a moderately sized home, it can feel very tight. So a lot of people are having problems with privacy. Where do I go? Where can I just chill out? And this is a real difficulty right now. Difficulty controlling the environment with that lack of personal space. Now, what are we doing about children that are interrupting us? So now the door may be closed and they're knocking on the door. Mommy, 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 daddy, daddy, daddy. What do? Well, you can send them to the other room, but it's very difficult. Or exterior noises. You're hearing now outside noises or noises when the door is shut. You're hearing them talking, sometimes loudly, your husband or your wife out there talking, and so there are interruptions in the house. So we mentioned before the kids knocking on the door. So what do you do with the young children in particular? Is very difficult right now with working from home. You set a limit for all of the ages, but let's say the young children, you say when the door is closed, mommy and daddy are working, you cannot knock on the door, you cannot disturb us, okay? And then you have to direct them to do something else. Why don't you do a craft? Why don't you read? Why don't you do this quietly in another room? That's a challenge for little kids. That quite frankly, that's very difficult for the little ones to do. You try to set that limit. The children older, like middle school, that kind of thing, they tend to do that, but a little less than the younger ones. They're a little more cognizant of the need to not interrupt you when you're working in that room. And teens oftentimes don't do it because they're a lot in their room and doing their own thing. Now, finding balance between thinking negatively and positively, reframing negative thoughts. So as I mentioned, I'm a cognitive behavioral therapist, and this is a great part of what I work on with the clients that I see. Okay, I work on reframing negative thoughts. So a lot of people have negative thinking, and when you have a negative thought, I call that an automatic thought. It comes into your brain, and it causes you to have anxiety or depression. And we work together. As a therapist, I'm working with a client to reframe that negative thought and make it more palatable and more pleasant for the brain to hear. Okay, so let's take this for example. I am stuck in the house. That's the negative thought somebody might have about what they're going through. And how can you reframe that? Well, to a more positive thing. You say, well, actually, you have more time home to be with family, and you can learn about them more, you can speak with them more, you have more time with them. A much more positive thought, a much more palatable thought for the brain to hear. How about these virtual get-togethers with family and friends? Zoom. Now, I've noticed, I talked to a number of people that for Easter they were doing Zooms with family and friends, which was very nice. And in Passover, the Seders, there were a lot of virtual Seders this year. And people seem to really like those virtual get-togethers. They seem to go well. Find control. All right. Now, in this situation, we don't have much control. In the whole general thing is lack of control. But find control in little things like washing your hands, the social distancing, wearing the masks and gloves, and working virtually. These are all ways we can have some control, and human beings want to have control. So that's why it's very difficult for a lot of people to go through this. And recognize and utilize. We have the technology to bring us the ability to work and connect remotely. We have that now. Recognize it, use it. Use the Zoom that you can with family. Use the Zoom. I'm sure you're using a lot of Zoom with work and connecting with others remotely.
Actually, interestingly, Carol, my daughter that is home from ballet school, she actually does stretch classes and ballet classes using her iPad. and kind of
Oh, wow.
propping it up in the basement and making the best of the situation and stuff. It's pretty amazing, and it's a silver lining in it because it lets her to continue to do what she loves, even though she can't, be with others and doing it in a class. So
That's great. That's great, Rosemary, because she loves ballet, and that's important for her to stay connected. And that's one way she can, which is very, very helpful. Is she getting a lot out of it?
she is. She definitely is. And it's nice that I have noticed that there's quite a few kind of workout classes that different organizations are offering, or even individuals. There's some very enterprising people out there offering different things, different classes via Zoom, and it's really nice.
Yeah, that's great. Yeah, no, I know that's very important that you mentioned that, because that is happening with the exercise. That's very much happening. Okay, what about some more active strategies? All right, now this is one of the most difficult things for working parents when they have young children and latency or children in school, 8, 9, 10. What do they do with taking care of the kids and working if two people are working at home? I'm seeing a lot of alternating work and tending to the children. So an example, one person, the husband, let's say, is working in the morning, and the wife is taking care of the children in the morning. And then they rotate in the afternoon. Now the wife is working and the husband is tending to the children, or in the evening maybe. All right, so there's an alternating of taking care of the children, which is working to some degree, but it's very, very challenging and difficult. I have a friend, there are fortunate people out there who have someone to help with this. I have friends that are taking care of their daughter's baby, and the daughter and son-in-law are lawyers. They're working from home, and they go every day to take care of the baby, and then they go home. They're all quarantined, so I don't know. That's a wonderful thing. That's very fortunate for them, but not everybody has that. I would say most people don't have that kind of setup. And acknowledge that this is so interesting that now with the online learning and the video, the online assignments, this has created an added burden to parents, because parents now are having to be like teachers. They're getting questions from their kids. Or, they're saying, Mommy, Daddy, how can you help me with my math? And not everybody remembers all of this, depending on what age the child is. So, in effect, parents have had to become teachers, in addition to parents and workers or professionals. And it's a mixed role situation. It's hard to do. But one thing you can do is to ask the teachers for help. You can email the teachers and ask them for help. This is one strategy that you can use.
No, that's a great idea, Carol. I know I am not qualified to do some of the math that my kids are doing in high school. Right. And so I think it's something we all struggle with and get frustrated with, because we aren't able to help them in some instances.
But Rosemary, do you see the added stress with the mixed roles, that now you're teacher, parent, and you're also a worker, an employee, or a professional?
Oh, absolutely. I find myself actually. Yeah, I find myself more tired. I mean, because you have to start your day by getting the kids
right
you get yourself up and get going, but then you've got to get them up and going, and you've got to not only get them out of bed and dressed, but you've got to redirect them to sit down and get to work, and by the time you do all that, and then you turn to your own life and other things, and you've got to keep checking back on them. I mean, it's a lot. It really is. It's exhausting.
Yeah, I'm going to mention another thing, another strategy when we talk about the kids that can help with that. Okay, so let's get to overcoming some of these issues. What are some strategies? Well, first of all, make a daily schedule of tasks you want to accomplish, okay? What do you want to accomplish? Now, I ask my clients, I say, write down a long list of tasks that you want to accomplish, let's say at home. And then I tell them to pick one out. And usually, I have to tell you, I've gotten three people who have said, I want to clean my closet, which is very interesting. So they want to clean that closet. Look at the closet. I tell them, open the door to the closet and see what's in there. And they say, oh my God, it's overwhelming. So what we do is we try to create a schedule, break down that task, pick one thing, break it down into chunks or parts, and then do that task. It's important that you do one task a day now, because you're working from home. Can't accomplish too many things. One task a day, and it shouldn't take more than an hour and a half to do. Don't do that closet in one day, because the likelihood of doing a task the next day is greater if you don't overwhelm yourself the day before. That's a behavioral principle. You'll do it.
I'm smiling, Carol, because we spent one day cleaning out the garage, and the next day I thought I was going to do another closet, and I looked at the closet and I said, forget it.
Right. Because you did too much. You know what, Rosemary, you did too much in one day. You really did.
Yeah.
And like I said, the likelihood, if you spend 4 hours on the garage or whatever you're doing, the likelihood of doing another task the next day is less, because you spent too much time on it. Make it manageable. And then you'll have the likelihood of starting that closet. It's very interesting, and these are behavioral principles. They work. All right, now you have more downtime, reading, crafts, Netflix, puzzles. So you're going to do more of that, one hopes, to relax. Now, exercise. You mentioned, Rosemary, the Zoom exercises, which people are doing now, which is great. And even just walking. I'm walking around the neighborhood, and I see a lot of people walking or jogging or bicycle riding now. So people are trying to get some exercise. Now, maintain routine. Okay, so routine is critical here. Now, studies have shown that routine, if you maintain some kind of a routine, getting up, eating when you have planned, doing your work when you've planned, that all helps to reduce stress. The experts have done studies on this, and routine is a critical element. And keep your home organized and clean. Get the kids to help if they will. Sometimes that's very challenging, but an organized, clean home makes you feel better, I think. And it helps you to stay focused on what your work is, because otherwise you're thinking about all the things you need to do to clean up. And last on this one, limit your time watching the news about COVID-19. I say a maximum of 1 hour a day. There are people that are watching this all day long and getting obsessed and getting worried and talking about it all day. And an hour is fine. You can get pretty much all the facts in an hour, and then you move on to something else, because you can't be thinking about this all day long. Okay, now the areas of my practice that I do are mindfulness strategies. Okay, so the practice meditation. I don't know if any of you are doing it, but if you are, continue with it. The Buddhists practice meditation all their lives, and for centuries, they're practicing meditation. And it's very calming. Just to start, you can do 10 to 15 minutes a day. You sit quietly, a chair, or you can recline, you can lay down, it doesn't really matter. And you are thinking of your breath. You're breathing in and you're breathing out. And all you do is concentrate on the breathing. Now, if you get a negative thought, think about a bullseye, and there's a red center. In that bullseye, the task is meditating. Around it is anxiety and noise. And the anxiety and noise sometimes interferes with your meditation because you think something. Oh, I better do this. Or this person's upset with me. Acknowledge that thought, continue meditating, and go right back to your breathing, concentrating on your breathing. This really works, and it's very, very helpful. If you want an app, you can go to Headspace in the App Store. Some people like Headspace, but you can do it really on your own. It's not really that complicated, and you can read up about it as well. And I say be present with yourself, okay? Be now. Be in the now with you. What do you feel now? What are you going to do now? Everything is focused on the now and the present because we have no idea what the future holds. We don't know. We didn't expect this, did we? If you would have talked to us in November, December, we never expected this. So that's the future is so unknown. So concentrate on the present. And people do worry about the future. They spend a lot of time worrying about, well, what's going to happen? What's going to happen? Stay focused on the now. And have compassion for others, okay? Do compassionate things. Look at how generous you can be. Maybe you're helping other people. Maybe you're donating to causes. There was a very interesting article that I read about a woman from Minnesota, a young woman from Minnesota who came to New York City to Elmhurst Hospital in Queens, which I happen to know, and it's a very crowded, it's crowded with all COVID now. They're having a really hard time there. And she went there, this nurse from Minnesota, and she said she was so amazed at the healthcare system, how everyone was working together, how they were trying so hard, and she felt good about her contribution to that. And what does that show us? It shows us that there are people out there that are giving, that are compassionate, and that are kind.
Hey, Carol.
Yes.
One of the things I've noticed in my house is that nobody seems to be sleeping very well. Like, I hear different kids up in the middle of the night. I hear my husband gets up. Sometimes I get up. Like, you know, and and I'm always kind of got, you know, my ears open and one eye open in kind of observing it all and stuff. But I have noticed that everybody's, you know, no one seems to be sleeping the night right now.
Yeah.
Any thoughts on what?
Yeah. Sleep problems are a big issue right now. People aren't sleeping as well. I've had a lot of the clients saying, I'm not sleeping. They're thinking about this. You know, some people are thinking about this 24/7. It's in the back of their minds all the time. And maybe in your family, people are dealing with the COVID situation. Maybe your husband, you, and the kids. Maybe you can talk about some of that with them. Talk about the sleep, why they're having some difficulty sleeping. And are you thinking about it, Rosemary? Are you thinking about this COVID thing at night when you're trying to fall asleep? Or are you thinking about so many other things related to this. You have to, one technique you can do is to write everything down that you're worrying about or thinking about before you go to sleep on a piece of paper. That really helps to get it out of your mind. To get it out of your mind. You want to get those thoughts out of your mind, and then you say, okay, now I can go back to sleep. And you can do that before you go to sleep, even in the middle of the night if you're having trouble sleeping through.
It's a great idea.
Okay, and talk to the girls about it and your husband. But identify methods of stress management, okay? How can you help the kids with stress management? I'm going to give you some ideas. And you need to support them, so remember them. Remember they're going through this too. It's not just you. It's not just your husband or your wife. It's everyone's going through this. And you have to, and the teens and children are very important to you. Now, the CDC says all children do not respond to stress in the same manner. If you see some of this, pay attention, and you can well attribute it to a lot of stress if there's not something physical, like, for example, excessive crying or irritability for young children. As long as they're not sick with an ear infection or something like that, and they're just being irritable and cranky and crying a lot, then you can say, oh, I think this might be a sign of stress. With young children, returning to behaviors they have outgrown, like they outgrew the bedwetting, they outgrew the tantrums, all of a sudden you're seeing them back. That's a regressive sign, and that could show stress in that child. What about excessive worry and sadness? I don't know if any of you have had this with the kids, but excessive worry, thinking about it all the time, worrying about you getting sick, your spouse getting sick, them getting sick. Just worry. That's a sign of stress. And sadness. I'm so sad. I'm in the house. I can't see my friends. This is terrible. Excessively. Not just once or twice or whatever in discussions. Sleeping or eating, and Rosemary just mentioned the sleeping part, sleeping too little, sleeping fragmented during the night, and sleeping too much is another one. So now you're seeing children that are sleeping way more than they should, and not going to bed at 4 and 5 in the morning, but going to bed normal, now sleeping to 2. Like, why is that? Not unnecessary. And eating habits, they can't eat, all of a sudden they can't eat, they don't want to eat. And in teens, irritability and acting out. Teens push limits, so some of them, I have one teen that was talking to me about sneaking out of the house to see friends, and of course I discouraged that, and she said, okay, but she wanted to go to see her friends, and she was going to sneak out of the house. So you might see some of that, and that might be a sign of irritability, and acting out may be a sign of stress. What about another one that you might see? Poor performance in online school. Now, I have teens and young people like 19, 20 that I'm working with, and some of them are saying, I don't care about the online school. I just don't care. It's not good. I get nothing out of it. They don't teach me anything. So poor performance, why are they doing that? Why are they not attending to the school? So that's a sign that we have to pay attention to, and difficulty concentrating and paying attention. They used to be better at it. Now all of a sudden they can't pay attention and concentrate. And then there's the unexplained body discomforts like headaches, stomach aches, back aches, things that they normally, leg aches, knee, things that pains all over that they never had before. That could be a sign of stress. And then not seeming to enjoy it activities they used to love individually and as a family. So let's say you always had puzzles that you did together, and this child said, no, I don't want to do that. Or you played board games, or no, I don't want to do that. Why does the child not want to do these things that they used to enjoy? And in teens, if you see this, alcohol, drinking alcohol, smoking, vaping, or taking drugs, even marijuana, pay attention to this. This you have to really set limits on. This can't be. You have to work with them and say, no, you can't be doing these things right now.
Yeah,
okay.
And Carol, and we just, I actually just read today that in Morris County, overdoses are up by 38% this year. So
wow.
Probably a real problem, that we have to think about and kind of think about and address.
Yeah, you're bringing up a good point that I could mention too, that the alcohol is up in adults. The marijuana is up in adults. Not sure about the vaping, but it probably is. And the treatment centers are working virtually with people. They are doing these Zoom groups and things. And so they are still available even though you can't go to a treatment center per se. They're doing it through Zoom. So that's something to consider. If you know anybody that's drinking too much, smoking marijuana too much, pay attention and tell them that there is help available out there right now, even right now when you can't go to a treatment center. Okay, so how do you support the children? Well, first of all, importantly, you tell them that it's okay to have feelings of sadness, anxiety, and worry. You're having those feelings. It's certainly okay for the children and teens to have those feelings. This is important that you reiterate this to them. Don't worry about it. It's okay. Everybody's feeling this way. That kind of thing. And help children and teens deal with emotions by modeling your calm and confident behavior. Now, when talking to the children, you have to be calm, confident, collected, steady. Explain everything facts. Explain what the family is doing calmly and confidently. It's very important that how they'll model some of your behavior. So if you're, like one girl said to me, she has a mother, she's 19, she said her mother's running around very nervous, like a nervous wreck about it. And it's passing off to her. She takes that in. She's saying, well, I guess I have to be nervous about it too. Engage in conversations and discussions with your children of all ages. Now, you're going to talk differently to a young child than you are a teenager, okay? And holding these family meetings to discuss the COVID concerns, when you're doing those family meetings, let everyone say how they're feeling about COVID, about all their concerns about it, and any other conversations and discussions. Maybe they want to talk about friends that they're having problems with, or things to do, or things that they're not doing, or whatever. All those conversations and discussions with the children are fantastic and very important. Reassure them that they are safe. Reassure the children and teens. Now, how do you do that? How do you reassure them that they're safe? Well, one thing you can say is well, we're doing all the precautions in this family. We are using masks. We are using gloves. We are washing our hands constantly. We're using alcohol. We're using sanitizer. We're using all of these things to stay safe. We're not going out unless we absolutely have to the pharmacy or the supermarket. So we are trying to be safe and reassure them that they're safe because of all the precautions you're taking. Acknowledge your own stress and model effective coping skills. So how are you dealing with the stress? What are you doing? You're doing some of that meditation? You're doing some of the mindfulness? Are you doing some of the breathing, some breathing techniques? Model that for them and teach them how to do it. You can teach them how to do the breathing and meditation, and they can learn it. And sometimes they really like it, by the way, the kids. I'm talking about, like, you know, the ones I work with that are like 11 years old, 12. They really like the meditation. Help children to maintain routines with online school, eating times, sleeping times. Okay. Now, remember what I said about routines, how important routines are? And remember, they're in school, in regular school. And what is school filled with? Routines and structure. And so you want to maintain those routines at home with the online school, getting up on time, getting to the online virtual school on time, eating at different hours. You know, you eat early, then you eat lunchtime, then you eat dinner, and the sleeping time. Stick to, by the way, very important for adults and children, stick to the sleeping times. Go to sleep at the same time and get up at the same time as you would before.
Before we jump to the next slide.
Yeah, go ahead.
Before we jump to the next slide, just a quick question. I thought this was a really good question, came in from someone. Any suggestions for the sibling bickering? I certainly know we have plenty of that in our house.
Well, bickering and fighting, only verbal, right? No physical, right? The physical has to stop. You have to put them apart. Sometimes you get boys fighting with each other, really physically. With the kids, you can tell them that, look, you may be bickering a lot more. You're on edge. By the way, we all have to be patient with people, and you can explain this to the children, to the siblings. We have to be patient. People are on edge with this thing. They're on edge, and we have to be patient and understand that some of the nastiness and the snarkiness and the irritability are natural, and because we're all on edge, and that they have to be patient with each other. And that's what I would explain to those two siblings, that please understand that you have to be patient with each other. Talk to them and speak very, very clearly about, you know, what are you guys doing? Why are you fighting? And oftentimes you get down to something that's not even that important. They're just doing it, and they may be doing it more because of COVID. So this is autism. I'm sorry.
Yeah, no, I was going to say, well, your next topic here on what to do with autistic kids. I mean, this is clearly a community that is suffering the most. I mean, you know, it's near and dear to my heart having an autistic nephew. So I'm looking forward to hearing some of these strategies.
Yeah. I picked this out because it's Autism Awareness Month, April. And I thought, how do you deal with special needs children? I mean, these are children of all types of special needs. And one I picked out because it was Autism Awareness Month was how to talk to a child with autism. Now, autism is a communication and a socialization disorder. It's both. So with the autistic child, you need to be clear, very clear, and use visuals, use pictures, use gestures, as well as words. Put up things that they can see. Gesture things with them with your hands. Try to get them. They need the visuals, okay? They need you to be clear, but they need the visuals. Speak clearly and explicitly about the crisis. Speak about what's going on. That people, in the next one, that people are getting sick, but that there are doctors out there to help, that this is a difficult time, but there's help, and you have to always stay positive. I'm going to ask you, Rosemary, about this when we finish this. I want to ask you if this might be helpful. Explain ways to social distance at the time of no touch. Air handshakes, air high fives, things like that. When they're with anybody, family or whatever, the social distancing is important. And connect with caregivers that are not present now through the technology like FaceTime or Zoom calls. You know, I have a friend who's divorced, and her husband right now has her son, who is 24. And it's very difficult for her. She's doing FaceTime with him, but he's in Florida and she's here. So she has to do that. She said it's working out okay, but of course she wishes she could be with her son. And teach some of these self-regulating techniques to calm down that I've mentioned to you. They can learn them, the autistic child can learn meditation and deep breathing. You know, counting, concentrating on your breath, breathing in, breathing out. These are important techniques to calm down. And stick to old routine as much as possible. Routine and structure is very important for the autistic child. They like the same thing. Now, they are having a trouble now because a lot of them aren't in school, which is throwing them off greatly. But try to make a routine at home for them that they can stick to a little bit, as much as you can. Does that help a little bit, Rosemary?
No, that's very helpful. I mean, I think I couldn't agree more that it's all about the routine, and certainly these times make it incredibly challenging to do that, even down to the point of routine on food. Autistic children tend to like to eat certain foods and the same foods. And, you know, right now we're in an environment where it's not always available, or, you know, or you can't get things. And so it makes it really, really hard. And they don't, and it's difficult to help them understand why. So.
Mm-hmm. That is such a challenge for your family to deal with, and you. Okay, how do you talk with the children? Remember that they react to words and your intonations and body language. So let's say, and kids have antenna, highly tuned antenna in ears. They can hear things. When you ask them to do something, it's like they didn't hear a word you said. But if you're talking to your spouse upstairs about something, they can hear that, and they listen to that. It's very interesting. So you're talking to your spouse about COVID-19, and they are reacting to it. Oh, what is mommy saying to daddy? What is mommy saying to grandma? What is, and they can react to this. They react to these words. And age-appropriate information. Okay, so a little kid, a young child, you're going to talk to, let's say a 5-year-old, 6-year-old, you're going to talk to about there is a virus out there. It is hurting many people. They are getting sick, but there's thousands of researchers and doctors that are working on it, and they're also out there helping those people that have it. So it's very simple. Now, the teens can handle a lot more. Even the middle schoolers can handle a lot more real information about it. But stick to the facts that you know about COVID-19. Now, you have to do a new routine. You know, they're talking about this new normal, and really I say it's like a new routine. First of all, we all need to continue to do the hand washing, coughing, sneezing into the elbow or the tissue. washing our hands with soap and water or hand sanitizer. Now, this is one that I said I was going to mention something that would help with the lack, with not having as many interruptions when you're working from home with the young children and even the older ones. Make a daily schedule for them, similar to what I was mentioning to you before about you. Give them things, say, okay, now you're going to do this, now you're going to do that, now you're going to finish school, now you're going to, attend to some friends, you may contact some friends, now you're going to play, you got to have a structure for them. And, like we said, structure is very important, and a schedule will help, because if they're busy on their schedule, they're not going to be knocking on your door. Or I'm hoping they're not going to be knocking on your door. And teach your children to be thankful for what they have. This is very important for children. Tell them that they have a lot more than a lot of other people have, and they have to be grateful. And on a nice day, go outside, play catch, bocce ball, badminton, wiffle ball, with the little ones, bubbles and hopscotch. And try to watch movies together as a family if they're willing to. And sometimes they are, and the teens sometimes aren't. So don't get offended. Now, my clients always say to me, Carol, what's the silver lining? Because I always come up with a silver lining in difficult times. And one of the silver linings I came up with was more time to connect. You have more time to connect with your family. You have more time to connect with other relatives that are not there. Make time to laughter. This is a time when you can laugh together. Encourage laughing. Encourage watching some silly shows or SNL on YouTube, or stand up and enjoy those times, and that is a silver lining. We have more time for that. And we have more time to be away from the technology because we have more time. And reconnecting with people is a real silver lining too. People that you haven't heard from. I have people that I haven't spoken to in many, many years that are contacting me now. Anxiety and sadness is not the blues. Okay. The blues is what we were talking about more before. Now, what is anxiety and sadness? That's not it. That's more of a warning sign. Difficulty sleeping, too much or too little, or fragmented sleep. Disturbed appetite, not hungry. These people will say they look at food and they are not hungry. They don't want to eat it. It disgusts them to see the food. That's a problem. Eating more or less. They're eating nonstop, binging, going through the cabinets at a feverish pace. That's a problem. Or not eating at all, or eating very little. Loss of interest and engagement in activities they used to like. All right, like they used to like to do things with you. They don't anymore. They used to like to contact friends. They're not anymore. Mood swings. This is true for everybody. Moodiness, up and down. You see happy, then you see sad. And teens can show a lot of mood swings. So, you have to, that has to be looked at a little more carefully. Irritability in people. Guilt feelings. There are people that feel guilty about not being productive at home, working from home. Oh, I'm not as productive as I used to be in the office. They're feeling guilty about other things, family things. I'm not being good enough. I did wrong with this. Thoughts of self-harm, cutting, I want to end my life. That's serious. And like I mentioned before, the increased use of alcohol, tobacco, and drugs. They're drinking too much. They're smoking pot too much. What if you have signs of depression that I just mentioned? Consult with an experienced mental health clinician. This is a licensed clinical social worker, a psychologist, or a psychiatrist, okay? Anybody that can help you. The psychiatrist prescribes medication, and the licensed clinical social worker and psychologist do not. They do therapy. And please use seeking help as a sign of strength and courage, because I tell people all the time that get in the door, I say, you are strong and you are courageous. And they say, what do you mean? I feel very weak. I feel like a failure. I said, oh, no, no, no. You're strong and you have courage, because there's a lot of people out there that are not getting help. Be aware that technology has allowed therapists and psychiatrists to offer teletherapy appointments. Okay, I'm doing virtual, I'm doing telehealth through Doxy.me, which is a HIPAA-compliant platform. It's working out very nicely with people. I'm also doing phones for some people that don't want to do the video. And so, you know, we have help at home. We can do this virtually from home, from the computer, tablet, or the smartphone.
Well, Carol, thank you so much. We are at the top of the hour, and I'm going to put your contact information up here as well if anyone wanted to follow up with you, or if folks wanted to reach out and get the slides from us, you can certainly get them at info@beckyforcongress.com. We put the slide there we go, and there's Carol's information if anybody would like it. Thank you, Carol.
Rosemary, just let me mention to everyone out there, please feel free to email me. I will answer you, or call me on either of those numbers. The office number, I'm not there now, but you can contact me on the cell. And please, thank you so much for allowing me, Rosemary, to do this, to share this, and thank you all out there.
And thank you, Carol. As I said, this is just incredible information and really helpful to all of us. So, and thank you, everyone, for joining us. I hope you are safe and be well, and we will talk to you soon. Thank you.